trying to keep up to date with changing child psychology as well, because children are getting more educated. They have access to a lot more information. They're very observant. We know they love to copy what's done. Some things don't change, some things do, and it's a challenge keeping up with it.
Hello and welcome to another episode of Origin Story, the primary packaging podcast. Joining me today is one of Origin's longest serving employees and an expert in his field. It's Jon Lant. Jon is our head of product development and a font of knowledge on a range of different topics, including today's focus, and that's child resistance. Hi Jon, how are you doing?
Yeah, good, Steve.
Excellent. So, what exactly is child resistance in relation to primary packaging?
Yeah, child resistance, or CR packaging as it's often called, is the name that we give to packaging that's been designed to make it difficult for children to open, but easy enough for adults to open. And getting that combination between the two is often an interesting challenge in my job. The primary purpose of CR packaging is to reduce the risk of accidental injury to children. An ingestion, an unintended ingestion, could be a medicine, could be a household product. Button cell batteries, could be household detergents, dishwasher tablets, all these things we've seen over the years. The packaging around them has evolved, and it's all with a view to reducing the risk of child ingestion. That, in a nutshell, that's CR packaging.
Thank you, Jon. That makes a lot of sense. And how would I know if something is right from a child resistance point of view? Are there any international standards that have to be upheld?
Yeah, there are, Steve. There certainly are. I think it starts before that. I think there's an ethical as well as a safety challenge to be borne in mind when we look at child-resistant packaging. It's very important to assess the risk. In terms of medicine, that's usually measured in toxicity. But then in household products, it's often just the physical danger. Button cell batteries was one of the ones that immediately comes to mind. Very easy for a child to swallow, and the damage, irreparable damage that does. So there's a number of aspects to consider. And once that risk assessment has been made, then there are some governing bodies and accreditations that apply to ensure that your packaging is fit for purpose.
Okay, that makes a lot of sense. And when we talk about child resistance, what kind of age of child are we talking about?
Yeah, so the ISO 8317, which is the standard that applies in the UK and Europe, follows very similar paths to 16 CFR, which is the American standard. Focuses on children that are below the age of 5, so 42 to 51 months is the test panel. It's a very stringent test. It requires a panel of 200 children and 100 adults. Both are really critical. The demographics are all taken into consideration, whether a child's actually been submitted to a similar test previously. If they have, they'll be excluded. We'll speak probably a little bit later on the adult aspect of it, but both run parallel, both whichever test protocol you follow, it'll take into account the child resistance element, but also critically the fact that adults can open it.
Fabulous, thank you. If I needed my product to be packed into child resistant packaging, what are the kind of things I would need to consider?
Great question, Steve, and one that's sometimes overlooked, because when you look at following a regulation, you can it's very easy to focus on the regulation and overlook the environment into which your product's going. That has a direct impact actually on the brand acceptance. Nobody wants a package that's difficult to open, but there is a requirement of a certain level of complexity in a pack. So I think the harm, the level of harm, is the first thing that should be considered. Also, the environment into which the product is going is a really important consideration. Some environments present a higher level of risk than others. We usually refer to that as, in the medicine world, as supervised and unsupervised dosage. A supervised environment, such as a hospital or clinic, is where there are certain protections in place. Medicine isn't easily accessible. It's given as a measured dose to an individual patient. And the risks in those environments are relatively low. And brand owners will often pack products for that environment in a different format. In the household, of course, the risks are so much higher. You have to consider those facts. You also need to consider what your product looks like. What does it look like to an adult, but what's it look like to a children? Because children see things very, very differently. And we actually ran a program some time ago on with that theme. Children see things differently. It brings that point very vividly to life. There's a really critical point in ensuring that packaging design, as well as the functionality and the test criteria that all surrounds it, are appropriate to your brand.
That's really good. Yeah, it's a really good point to consider that. It's not just about how it works, it's about how customers will use it and how we use it. That's brilliant, John. Yeah, thank you very much. Just thinking about this, what's Origin's experience in this world? What kind of industries are we working with currently that take advantage of our CR experience and skills?
Yeah, it's good, Steve. Our core focus has always been pharmaceutical, prescription meds or OTC products, household products, healthcare products. In fact, the principles of child resistance don't really change that much. The test standards, the protocols we follow are applicable in whatever industry. They weren't written for any specific application. But our focus and our experience over the last 60 plus years has been in dispensing pharmacy, how that packaging is used in the home, the user experience, and trying to keep up to date with changing child psychology as well, because children are getting more educated as they have access to a lot more information. They're very observant. We know they love to copy what's done. Some things don't change, some things do, and it's a challenge keeping up with it. I think anyone in product development in terms of child resistance, some understanding of child psychology is actually quite important. It used to be said that you could design a pack in such a way that in the end a child would give up trying to open it. I'm not sure that's true. They tend to be very persistent and very determined to find their way into something.
So putting it all together, John, it sounds quite a challenge, to be honest, and obviously one that Origin have done for many years. How can Origin help customers and potential customers overcome their child-resistant packaging issues?
It's a good question, Stephen. We'd love to sort of break down any barrier or concern brand owners may have as to the complexity of this. There are a lot of pressures on brand owners, and not least the whole question of sustainability and how do we make sure our products are safe without over-engineering, introducing cost. There are some advantages in that there are some standard formats, even sizes of container, rigid packaging, flexible packaging available, and many of those can be adopted to suit existing brands. And we'd encourage brand owners to speak to us, reach out and speak to us, just tap into our knowledge over the years, the way we've evolved packaging sympathetically. It's very important, especially in some of the OTC applications where you want shelf appeal. You're not wanting to present something that looks unfriendly to use, and some can be unfriendly to use. But I believe there's enough basic concepts out there, and sometimes a bit of a meld of various ones coming together can give brand owners actually a market advantage. There are a lot of technologies now in moulding that have evolved, and a lot more opportunities to be creative in the way that we present child resistance. Bringing in brand colours in mould, logos, can take away the inconvenience, really, of child resistance. I think it would be wrong to pretend that child-resistant packaging is convenient, but you have to look at the bigger picture.
Yeah.
I think one final message, and probably not always understood, is if you are of limited dexterity, your pharmacist is permitted to remove the child-resistant feature of a pack if they believe it's safe to do so and give you a non-child-resistant package. And Origin obviously have those available as well to offer.
That's fabulous, John. I appreciate your insight into what is a massive topic. And I think certainly one of those that once you start pulling apart, there's more to it. But as you say, the rules are pretty straightforward. It's all about how it's managed, and not just the fact that the pack will do the things that it's supposed to do, but also will have that appeal. And certainly things that as a company we've done for several customers around the world over the years. And it's something that we do almost as a easy thing, but we appreciate that that's not the case for every single customer. Brilliant. Thank you very much for your time today, John.
Very good, Steve. No, it's been good being with you. Thank you.
Massively appreciate it. Thank you. If you want to know more about child resistance and how Origin can become your packaging right hand, visit our website at originltd.com. And keep an eye on our YouTube channel and LinkedIn feed for more episodes of Origin Story, the primary packaging podcast.